Well, we're learning more about what care looks like for COVID-19 patients,
including what they can expect after recovery. Kate Raddatz spoke to the ICU director at the Mayo Clinic to find out how doctors and nurses help patients in isolation stay connected to the outside world.
Mayo Clinic Intensive Care Unit Director Dr. Richard Oakler says most people who come to the hospital have spent a week in care. Patients with less severe symptoms may start with IV fluids or oxygen and move on to other treatments if their condition worsens.
Where we put a breathing tube in, or potentially just a tight-fitting mask like a CPAP or a BiPAP mask that many folks wear at home, all the way up to things like extracorporeal life support.
Most patients who are discharged from hospital care will not have any lasting side effects, but Dr. Oakler says a patient with severe respiratory distress could have a different outcome.
We know from previous data, even before coronavirus, that those folks can have lasting effects on their, not only their breathing function, but also are susceptible to other problems getting back to normalcy for up to several months to, potentially even years.
Dr. Oakler says one of the challenges is that people who are sick or in isolation, kept away from loved ones, a void he and other healthcare providers have tried to fill.
But we do provide basically a video conference like we're doing now. We have that ability now in every one of our ICU rooms so that through the TVs in their individual rooms, patients can interact with family members.
Dr. Oakler says the Mayo Clinic has not seen a significant increase in cases since the stay-home order.
Everyone making these hard decisions and sacrifices has really flattened the curve. Minnesota is a shining star in the country with regards to infection rates and how that curve is increasing.
Kate Raddatz, WCCO 4 News.
Dr. Oakler said the Mayo Clinic does make an exception to the visitor rule if a patient is not going to survive. The majority of patients treated at Mayo do not need care in the ICU.